Hi, I'm Henry Acosta, and welcome to Health Professional Radio. Today, our guest is Jane Wiggers de Vries. She's a nurse at St. Vincent's Private Hospital. She got diagnosed with fast-growing triple-negative breast cancer, a very rare case for someone really young. She has the BRCA1 gene, which increases her chances of getting both breast and ovarian cancer. Since her diagnosis, she's gone through treatment such as chemotherapy, radiation therapy, and a double mastectomy. Thankfully, now she has lived through that. She has beaten cancer and now wants to help raise awareness of the dangers of breast cancer and help spread the word and support the cause. As we all know, October is Breast Cancer Awareness Month, and we're here to help spread awareness about it and make a difference to everyone who's listening and want to get involved in spreading the message. Welcome to the program, Jane. It's great having you here on the show.
Thank you. Thank you for having me.
And for our very first question, when were you diagnosed and at what age?
So I was diagnosed with breast cancer last year, and I was 24 years old.
And what stage were you diagnosed with?
Well, I can't remember the actual particular stage, but I'm pretty sure it was stage 2B or something like that. It was already 4.5 centimeters, so it made it quite a large cancer already. But yeah, I think it was stage 2 or something.
And how was the cancer initially detected?
Well, initially detected by myself. So I suppose at the age of 24, I was not going to be going to the doctor and getting mammograms or anything like that. I was extremely healthy and extremely fit at the time, and I suppose I was just laying in bed, and I think the position I was in, the way it stretches you out, I just felt a lump about the size of a golf ball, but it was all like a marble, and then I just thought I'd pulled a muscle, but I hadn't. So I went and spoke to a few nurses at work, and then I went and got an ultrasound.
Right.
Go on.
Oh, I'm sorry. You can go ahead.
And and then after the ultrasound, I got some biopsies done, which confirmed that it was a fast-growing, aggressive breast cancer.
And how did you feel when you first received the news?
Receiving the news was like a bad dream. Like, I didn't feel that it was actually real initially. I just thought, oh, okay, like a skin cancer, like, I can get it cut out. It wouldn't be the end of the world. But then the news kind of settled in, like, over the weekend, and it was, like, the most devastating thing. Because one day your oncologist just tells you you're going to have to get your breasts removed. You're going to have to go through chemotherapy. Your chemotherapy might make you infertile, so maybe it's best to think about doing IVF with your partner. And then, yes, and you're going to lose all your hair, obviously. Then you're going to go through radiotherapy. I mean, it was a big process to take in, and you don't really feel 24 anymore.
And during that time, did you have a support network?
My support network was really good. I have a lot of friends and family that were just able to support me and get me through the hardest times. Like, going through the diagnosis, I had my partner with me, so we were able to do most of it together, and he was just fantastic. And he was able to just leave work, get to every appointment, drive me to every chemotherapy session. And then after chemotherapy, he would drive me up to my parents' place in the Blue Mountains, and we'd just get away from everything and just relax up there. I also had a really amazing young women with breast cancer support group as well, so I did that. And that's through the Cancer Council, and I meet up with these girls once a month, and we talk about things that, even though you have like great support with your family, you just talk about things that other people just would not get. it was really good.
And can you give us a little insight on your treatment process?
My treatment process, so everything that, all my treatment started at the Kinghorn Cancer Centre, which is related to the government. So I did 6 months of chemotherapy, neoadjuvant chemotherapy, and well, actually before that I did IVF to save some embryos for the future, and then I did the 6 months of chemotherapy, and then after the chemotherapy I got a bilateral mastectomy at St Vincent's Hospital, the private where I work, and then after that I did the radiotherapy every day for 5 weeks at St Vincent's again. So yeah, it was a long process. So it started last July and it went until about May, June this year.
Mm-hmm. And were there any program or services offered to you that would help with the treatment process?
The Kinghorn Cancer Centre had so many programs for going through, had services available. So there was, the first one I went to was a Look Good, Feel Better program, and it's like, it helped you to literally look good and feel better when you're absolutely feeling your worst. And they helped out with wigs and scarves and basically just mentally made you feel so much better. Then there's also therapy, and I could just get therapy whenever I needed it. Any psychology appointments, it was perfect, and that was all through the Kinghorn.
And did you face any obstacles during your treatment process? And can you tell us or can you share with us how you overcame these obstacles?
Obstacles? I mean, there were hundreds of obstacles. Just like, I feel, for me, the main obstacle was just feeling sick and becoming the cancer patient. Like, as soon as you lost your hair, you felt so terrible. So, like, you just felt like the cancer patient. So, for me, it was going to work. Even though I felt like terrible, I would work throughout my chemotherapy. So I would get back out I work in the operating theatres, and I would get back, and it was fine because I wore a theatre hat every day. So a lot of people forgot that I was actually sick, and it was just having that normality, that that process of getting up and having a routine. The other ways of overcoming it, I would go on short little holidays with my boyfriend Cameron, and he would take me either like down to Victoria, skiing, or up to the Great Barrier Reef for a couple of days, and just getting away was a great way for me to overcome things.
And what message would you like to provide women in the breast cancer community?
My messages would be for the breast cancer community, especially this week is Breast Cancer Awareness Month, is that breast cancer doesn't discriminate, and it's really hard because a lot of people are so shocked about my age, and it's really hard because the only way of detecting breast cancer at our age at the moment is by checking yourself. So it's really important to check yourself. And what else? I just think that for me, it is so important for research in this area, and if you feel like you can't donate your money at our age or anything, like, there are so many simple ways that you can help out. So I'm part of the Garvin Institute. You can download the Dream Lab app. This is what I've done. And you can use your phone, and you can select just a tiny amount of data, and it can use that data to help with their huge amounts of sequencing and all the processing they need for the huge amounts of research that needs to be done. So, and it's just simply by plugging your phone in, and while you sleep it works. So I've been doing that. So that's great, and that's a really simple way to do it. And just any money that goes towards the government goes straight to the scientists, straight to the labs of people like Dr. Samantha Oakes helping solve breast cancer. So yeah.
And with the Dream Lab app, can you tell us how it's helped with the process of being a survivor of breast cancer, and while you were getting treated? Can you tell us how it benefited you?
The Dream Lab app, I suppose, just knowing that it's helping the scientists. Like, I don't have to be there right with the scientists in the lab, but you can know that even if you're at home not doing anything, at least you're helping them solve it and getting breast cancer and getting the research done while you sleep. It's just great knowing that it's fast-tracking that process so that people won't be having to go through what I'm going through. But Samantha Oakes will be able to tell you way more about that and how it works, and yeah.
And to the listeners out there who want to help support the research and raise awareness of breast cancer, what's your advice on how they can help spread the message?
Spread the message? Well, check yourself for any breast lumps. But also, great thing to do is to download the DreamLab app, and you can select what cancer you'd like to support, and then basically you can select how much data you want to give to the DreamLab or to the government, and that can go towards researching, so we don't have to go through this anymore. So yeah, that would be my support right now in Breast Cancer Awareness Month.
Mm-hmm. Awesome. And again, that was Jane Wiggers de Vries, and it's a pleasure having you on the show.
Thank you very much.
Again, that was Jane Wiggers de Vries. At a very young age, she has survived a rare case of breast cancer. She's looking to help spread a positive message and share her experiences to help raise awareness on breast cancer. She is now a nurse at St. Vincent's Private Hospital. As we all know, October is Breast Cancer Awareness Month, and we're glad to help support the cause. You may go on www.nationalbreastcancer.org, or you can download the DreamLab app to help with the cancer research. Transcripts and audio are available at the www.healthprofessionalradio.com.au or on www.hpr.fm, and you can subscribe to us on SoundCloud and iTunes.